Good afternoon, sir.
Good afternoon. How are you?
Sir, it is really nice to see you on web today after so long.
And I'm seeing you every day.
Yes.
With all webinars, you are always there.
Yes, sir. Sir, for the viewers, I will have to introduce Dr. Atul Munshi, sir. He is my post-graduation teacher, and I think I was his first student in whose dissertation sir had signed as a professor. So I am really happy to be with him on the web. Sir was ICOG chairperson in the year 2014, and he was Indian Menopause Society president all over India in 2010. He was senior vice president in FOGSI in the year 2007, and I have no limit to say that how much happy I am today to have him on this web meeting. He was ex-professor in GCS Medical College in Ahmedabad and NHL Municipal Medical College, Ahmedabad. And I was his student in MD in 1991. So he signed my dissertation as a professor in 1991. He is on editorial board in Midlife Health, and he is a peer reviewer of our journal, that is Journal of Obstetric and Gynec of India, that is JOGI. So welcome, sir, on this web meeting, sir.
Thank you for calling me. I was surprised that when you called me and we'll be meeting on web.
Right.
He has introduced me. I like to say a few words about Geetendra himself. In the last 40 years of my career as a teacher, I met many students. As you know that some of them we remember by names, some of them we remember just by face, some of them we forget over a period of time. There are few we remember for a long time, then ultimately contact loss. But there are very few who will always be there with you. They'll keep an impression in your mind and head. And one of them is Geetendra Sharma. He's always the dynamic. I've seen him as a dynamic fellow, always rushing, always asking questions. He cannot sit anywhere if he's in a meeting or if he's in the conference. He's always there. His presence will always be felt. And he has come up to a place where it's a specialized thing. He has now been recognized as one of the topmost medico-legal specialists in India. And I'm proud of you. Geetendra, it is nice to see you over here. And any future, I think whatever you are taking up, my all best wishes are always there.
Thank you, sir. Sir, you wanted to ask something?
Yeah, Geetendra, because your specialty is there. Because there are a few questions which are in our mind. There are patients who are admitted and they go. Most of the patients with our type of practice what we are having, they will go after when we discharge them, they'll go. But there are certain patients which are likely to go with request. Say we want to go home. That is one type of patient. Another types of patients are there who like to just go away, abscond. And there are certain patients who will go against our medical advice. Now, what are the different things? Because after some time, some of them will come. That I want a discharge note. I want something for my insurance purposes. I want this for my registration of my child and everything. Now, what is our duty? Suppose patient has gone on his own, we'll definitely give everything. But patient will not like to give anything. Patient where we have requested and then gone, we might also. But patient who has gone against our advice, and suppose patient has gone absconded just, and then they will come and ask me about your discharge note or certificate of the thing. What is our duty?
Yes, sir. Sir, basically, whenever we discharge patient, it is our duty to give a discharge summary or discharge card to the patient in a normal routine way. But whenever patient is discharged at request, so see, whenever somebody is discharged at request, that suggests that you have accepted the request made by a patient. So your medico-legal liability or legal liability continue. If you accept the request of the patient, then you will be held liable for everything, whatever has happened or whatever will happen to the patient after taking discharge, because you have accepted the request of patient. Okay. Now, what is DAMA? DAMA or LAMA, these are the terms used: discharge against medical advice or leave against medical advice. So sometimes patient is not happy with the treatment, or maybe due to some other reason, if patient wants to go to somewhere else for the treatment, then they may go even against medical advice. and if they are not happy with the way of treatment they are getting, or they want another kind of treatment what you are not suggesting, so in those circumstances patient may take discharge against medical advice. So in such cases we always recommend that whenever patient is going against medical advice, it is advisable to take it in writing. So there is a consent, DAMA consent or LAMA consent. We must take signature of the patient in our DAMA consent, and DAMA consent should contain what is the reason, what was the condition at the time of discharge, and all the details regarding the reason of discharge against medical advice.
Correct.
And moreover, as you have said that is it our duty to give discharge summary or discharge card in case of DAMA? Yes, in case of DAMA and the LAMA also, it is our duty to give discharge summary to the patient. We cannot refuse. And
There we can mention that she has taken again.
so in case of Sunita Saxena versus a medical superintendent Mata Chanan Hospital and Nursing Home in Delhi. So the State Commission in 2012 decided that you are bound to give discharge summary even in patient of DAMA or LAMA, and you can mention that DAMA and LAMA in your discharge summary. Now the third thing, that suppose patient absconds. So whenever patient absconds from the hospital, so as soon as it comes into your knowledge that patient is now not there in the hospital, so it is your duty to document it in your papers that from this time patient is not seen in the hospital and patient has absconded without acknowledging anybody else. And it is always better to inform police in such a way that so and so patient is missing from the hospital, was admitted in our hospital, and in this condition, when I saw the patient last, at that time, this was the condition of the patient, and in this condition, patient is absconded. So once you will put that time and acknowledge the police.
Is it in the form of a FIR?
Yeah, it is not FIR, it is acknowledgement to the police.
Informing the police.
Yeah, information to the police. So once you inform the police, that will become authentic that you have informed the police that from this time, patient is not there in the hospital. So after that particular time, if anything happens to the patient outside your hospital, then you won't be held responsible for the same. So these are a few things which we should.
You mentioned about after request patient goes outside. Now yes. Suppose she goes to someone else and something happens there, then we are responsible for their own.
No, once patient reaches there, then we are not responsible.
Okay, so once she goes home, then something happens, then it is our responsibility.
Yes.
But if she goes to other doctor,
yes,
then that is not our responsibility.
Yeah. And in DAMA and LAMA consent, we used to write that you are going against my medical advice, and correct, if anything happens after leaving my hospital, then I won't be responsible for the same.
But the relative doesn't refuse to sign, then what will you do?
Yeah. So in that circumstance, sometimes patient is not happy with the treatment, not ready to sign, and they leave the hospital even without yes, signing. So in those circumstances, it is always advisable to document it in your case paper by yourself, and you should explain the consequences which can happen in future in presence of two witnesses. And those witnesses should be independent witness.
Okay, not from your hospital. Sir.
Yeah, not from the hospital. So if some patient is admitted in your hospital, you can take relatives of those independent patient, who is not your employee or who are not relatives of the patient also.
But now, this will be difficult at times. If middle of night something happens, then they will not be able to sign. So at least whosoever is ready. Yeah. So in middle of the night, it is said in the law that you must have report the efforts you have made. Correct. In night hours to get independent witness. So correct, if in middle of the night there are no independent witness, then even your staff can become witness. And one more thing, to authenticate that in a more authenticated manner. Yes. You can call your one of the colleagues, and that colleague should also explain everything to the patient, and that colleague also should mention in your case paper that I have also explained the same thing. And so if two persons say the same thing, live in a more authenticated manner. That's a good idea. Yes, sir. Thank you. You are mature like anything last few years, and I think that you should continue like this. Sir, for teachers and for father and mother, for guardian, child remains always a child. That's right, but it's always. But child is the father of man. That is also there. Father's Day is just not gone. And I've got many children with me. So my teachers, they are as good as my children.
Right.
I know that you are going for a bigger post in FOGSI. I wish all the best, and I see that you come in that particular position. Thank you very much. Keep your good work always going, and always remain smiling as you are.
Thank you, sir. Thank you.
Thank you.
Thank you, sir.